for a lateral gaze to determine if there is any nystagmus present. If you will follow the thin light in for me. Just look at the thin light. Next, we will move on to the trigeminal nerve. I am going to have the patient to clench her teeth. Clench your teeth down for me, and I will palpate the muscles of the face. No abnormalities, and they are both strong and equal reactions. Next, we will move on to the facial nerve. Mallory, what I'm going to have you do is smile at me and puff your cheeks out. And can you frown? And raise your eyebrow. And all of the reactions that she tested for were symmetrical and normal. She was able to follow along with my commands. Next, we will move on to the auditory nerve. And what I'm going to have you do is what is called a Weber test. We are going to use this tuning fork to determine whether your bone conduction and your air conduction in your auditory nerve is equal. You should be able to hear the sound and the vibration from this tuning fork. First thing I will do is place it on top of your head, and I want you to tell me whether you can hear that vibration in both ears, and then I'm going to place it behind your ear and then in front of your ear. Okay, so I want you to be able to tell me whether you can hear it, at the same time. Weber test is first. Next, we will and the air conduction should be about twice as long as the bone conduction. She was able to hear the sound. I'm going to test the other side as well. Next, we will move on to the 9th and 10th cranial nerve. Earlier when we did our head assessment, I assessed her uvula, had her say ah, so I was able to tell that that was normal and symmetrical, no abnormalities there. We tested her ability to swallow when we checked her thyroid. So the only thing left to do is test her gag reflex. And Mallory, what I'm going to have you do is next, we will take a look at the 11th cranial nerve. I'm going to have you shrug your shoulders while I push down against you. So shrug your shoulders up. Okay. And she does have a good, strong muscular reflex there. I'm going to have you turn your head to this side while I push against you. Okay. And the other side. The strength is symmetrical in both sides of the neck, so that nerve is symmetrical and working well. Next, we're going to look at the hypoglossal nerve. I did assess for tongue symmetry and movement whenever I had to test her gag reflex and everything. So one thing I do want to check is the strength of your hypoglossal nerve. If you can stick your tongue out for me and move it up and down. All right, thank you.